I am Dr. Anupam Bhargava. I am the Chief Urologist of Adiva Group of Hospitals, New Delhi. Today, I am going to tell a little about the prostatic gland, which is present in all males. An enlargement of prostate gland is an extremely common condition when a man grows older, especially after the age of 55 or 60 years. Every enlarged prostate gland does not require surgical intervention, but those glands which are bigger and where the medical therapy fails, we offer patients a surgical intervention. During the clip, I am going to show you today what is laser enucleation of prostate gland and what is a transurethral resection of the prostate gland. These are two technical terms, but I think it's extremely important to know what is the difference between these two procedures. Thank you. Now the procedure what you are watching is a Holmium laser enucleation of the prostate. The red light, the red glow which you are seeing is an indication that the laser beam is falling here, and you can see the laser fiber which is white in color and there's a color code of blue over it. It is passed through a ureteric catheter and you can see the gland how it is nucleated. Enucleation of these glands are gradually performed keeping a right plane. So now what you are watching is a right plane where the adenoma or the gland is lifted away from the capsule. This is the coagulation of the bleeder. You can see the fiber is kept a little away and is very well coagulated. If you see very carefully, you will find that we are maintaining a particular plane. It is something like we are trying to take out the pulp of the orange fruit and keeping the skin behind. The peel of the orange is the one which you can see is on the outer aspect, and the laser is completely enucleating the pulp. You can see the fibers which are transversely seen, white glistening fibers, very well seen here. That is the capsule fibers. And the laser is trying to lift the gland, which is the adenoma. Here we are coagulating the blood vessels very carefully so that the blood loss in this particular procedure is very, very minuscule. I hope you are able to appreciate these fibers, which are the capsular fibers. And here, again the blood vessel which is bleeding, we are able to coagulate that with the laser. All this is stopping the bleeding by laser. Again with the laser, and now the procedure is proceeding and we are able to lift the glandular portion of the enlarged prostate away from the peel. The peel is called in a surgical language as a capsule. We are going all around because the gland is like a chestnut and we are able to cut all the fibers very, very clean without any blood loss. The vision is very clear. So this walnut-like gland, which is present only in males and becomes a nuisance with the growing age, we are able to offer this procedure. The stay in the hospital is 24 hours to 48 hours maximum, and the patient goes home without any tube in the urinary passage, which is known as a catheter. Advantage is that the glands can be removed easily and the surgical complications are minimum. It is highly suitable for patients who are high risk, who have got a cardiac problems, and they are on blood thinners. With this, I would like to conclude the procedure This adenoma is removed by a process of morcellation and all the pieces are taken out or sucked out. Thank you very much.